So we're gonna scroll down. We're in pelvis already. Keep going, keep going, keep going. So down here we have the sacroiliac joints. I want you to hold shift, and I want you to click on the 3-plane lobe, hold shift. You can let go, you don't have to hold it. Okay, hold shift though, click on the sagittal T2. Now let go of shift, hold control. And you're gonna click on the axial T1, and you're gonna bring those over. This is because we're going to replace this axial T1 with the sacrum coccyx. Let's scroll up. Keep going, keep going, keep going, keep going. There we go. And scroll up a little bit more. Sorry. So we have encinitas sacrum coccyx. Double click on that. We have axial T1 right here. Click on that. Bring that over. Okay. And we can accept. So the reason is because the axial T1 in the sacroiliac joints is just a spin echo pulse sequence, conventional spin echo, so it takes like 10 minutes. And this one is much faster. It's like 2 minutes. Okay, so get something going. And while we wait for this one to run, let's correct this. So double click on that, let's open that up, apply. So that protocol that we pulled it from, the sacrum coccyx, uses the torso coil. However, we're using the spine coil, so we're going to change that. And we're going to click on whatever coil is plugged in. And the CTL coil. Now the CTL coil has 6 channel elements, with the top closer to the head and the cervical spine being like 1 and 2, and the bottom closer to the lumbar and sacral regions are like 5 and 6. So we're going to use the bottom half of the coil elements 4, 5, and 6. And you could, I don't know what this is, but you can click it and then accept. Apply or apply all, it doesn't matter. And then also we have to turn on anti-aliasing. So no phase rep. This is anti-aliasing. It's a small FOV. You will have anatomy outside of it. So in order to prevent rep, yeah, perfect. Okay. So you don't have to save it or anything like that. Even though it says 7.5 minutes, it will come down to like 2 minutes or so. Okay, let's go into the coronal oblique T2 fat set. There we go. Let's move that toolbar out of the way. Okay, let's window these. Let's go up and to the left. And up. Just go straight in. Keep going. There you go. Okay. Maybe even a little bit more actually. There you go. Okay. Yeah, perfect. So over here you can see the sacrum. You can see that it's much wider than the spine, and you can see these little black lines right there form the sacroiliac joints. So these guys right here are the ilium bilaterally. Okay, so over here we want the sacrum and coccyx. Down here and up here we want to see the SI joints. So let's find it over here. So you can see that we're in the lumbar region. Here you can see the vertebral body, lamina, spinous process and whatnot. So we're actually going to go up. One more.
Last one.
Oh, that's okay. We are landmarked pretty high up. So let's double click on this, or just left click, highlight, copy and paste. Double click on that one. This is called reloking. You can apply. You're gonna bring these down to like right here. Perfect. Okay. Hit save and scan. Okay. We're gonna go back into that coronal. You can click that. Table's gonna move. Basically, if you landmark up here, this is placed at isocenter. But now, okay, so if you landmark up here, this is placed at isocenter, but when we place and prescribe images down here, then the patient has to move up or farther into the bore so that now this area is at isocenter. Okay, so that's what's happening.
See him?
Yeah. Okay, so let's go into that coronal oblique, apply. Alright, so let's find our money slices, at least in this plane, and see if we have better visualization of the sacrum and coccyx over there, but this is a good slice. Not there, you can see the ilium all right there, but we lost the sacrum, so we lost the sacroiliac joint, so let's go up, keep going. Yeah, this may be our best slice. Let's go one more. That's a great one. Okay, we'll use that one. Let's just check, just for fun. Let's go. Yeah, let's check it. Okay, let's go the other way. One more. Yeah, that's the best one. Yeah, that's the best one. Okay, so down here, we already have our axials pop up, so I'm going to have you select series and bring up the second lobe, that new localizer.
Just in the bottom?
Mm-hmm. Now, let's scroll up and find our axials. We're going to look for those SI joints, sacrum, ilium, SI joints right there about to form, so go up one more. That's a great image, SI joints, those black lines right there. One more. Even better, keep going. Yeah, I would say that last one.
Do we need to increase the FOV on this one to get everything, or it doesn't matter if some of the...
No, that's just the localizer. Okay, so whenever you're ready, we're going to drop our FOV right here. Perfect. And we don't have an FOV because they're obliqued. So what I want you to do is I want you to angle these so that they're vertical, straight up and down. And now the slices are facing anterior and posterior, so we have our FOV. So let's angle these dots with the spinal canal. Perfect. Down here we can angle with the basically the anterior aspects of the SI, FSI joints, or you could angle with the spinous process, whatever works. Now what we can do is we can come back and oblique this. So if we have S1, 2, 3, 4, 5, and then coccyx, I want you to angle these lines parallel to S2, S3. Perfect, keep going. A little bit more than that. Keep going. Keep going. There you go. Okay, so now we can do our coverage. We're going to cut these until we get to the very end of the coccyx, the distal aspect. Perfect. And we could cut like one or two. I like to go to this disc right here, the L4, L5 disc, because that provides enough space posteriorly. So now let's do our TR. We have 2 times 10 is 20 slices worth of TR. We only need 11. So I want you to adjust your TR, knowing that that only adjusts this top number. The second number changes according to this one, but these will only adjust this top number. So if you want to go from 10 to 11, do you go down or up?
Down.
Yeah, there you go, you go up. So keep going all the way until you get to 11 times 1. There you go, perfect. Okay, that's a very good time. Let's save that and auto scan. Now we're going to go into the coronal. And we already planned a coronal. Do we need to plan another coronal?
No.
Okay, so what can we do?
With the sequence?
So you don't have to do that unless you're planning it. But we already planned one, right? So what can we do? We want these to match or be identical, right? So we should copy it. There you go. Perfect. Accept. Let's optimize our TR. 1 times 15. We only need 11 slices worth, not 15. So if we wanted to go from 11, or I'm sorry, if we want to go from 15 to 11, what should we do?
Down.
Yeah, you should decrease it, okay? But one other thing, just as a shortcut, now that you kind of understand like what's happening here, click this, and you could just click on one acquisition. Perfect. We have 1 times 11 equals perfect 11. 1 minute is solid, and T1 range is 350 to 750, so our TR is within that range. This looks good. So let's save that. let's go into the axial T2 fat set. You always want to be ahead. And SI joints, sacrum, coccyx, because you have to oblique everything, I plan everything from the local exers because those are true axial, sagittal, and coronals. So let's find our money slices again. If that's not the one already. Yeah, one more. I think it was either this one or that the one above it. It was either that one or the one above it. Okay. Alright, so doesn't matter, it's all pretty good. So now let's go up one more. There you go, that's the one we used, and this is that money slice for the sacrum coccyx. You can see the coccyx very well here. Okay, so let's see. I want you to drop your FOV in the anterior aspect of the sacrum, right on the black line, give or take. Yeah. Again, you don't have your FOV because it's obliqued. So I want you to flatten these slices out, make them horizontal. And now you can see that the slices are facing superior and inferior, so we have that FOV. Okay? So now, in the axial plane in particular. So if you want to angle this, you can, maybe a slight nudge to the right. If not, it's not going to make that big a difference. So the other way. Yeah. There you go. Okay. So now, over here, I do want you to angle with that spinal canal again. Perfect. And now we can oblique them over here. So we're going to angle it to the left so that these slices are perpendicular to S2, S3. Just a little bit more. Perfect. Okay. So now we could just grab these and move them, but instead I'm going to have you extend your coverage down to the back of the coccyx. Perfect. And anteriorly we could cut to like the top of L5. So yeah, maybe like to like right there. Perfect. Okay, looks good. We have 22 slices. 3 times 10 is 30. We only need 22 worth. So what is 22 divisible by? We have 1 times 22, 2 times 11. So let's go for 2 times 11. You could do that, but instead let's keep practicing this. So remember, those only adjust this top number. So let's go to 11. Perfect. Let's do the lowest, 11. Perfect. Okay. That's not long, but yeah, let's shorten that. Let's just drop the next to 2. Perfect. Save. And let's go into the axial T1. Just making sure we still have the right coil. Lower 3 channels at the CTL coil, and we have NPW, no phase rep. It's that anti-aliasing. So we're good. We are going to plan an axial, but we already have an axial planned. So do we have to go through and do the angling and coverage and all that stuff again? No. Yeah, let's copy the axial T2 fat set. Okay. 22, so we could try to go up to 11 again. Let's see. Let's click here and do 2 acquisitions. Oh, it doesn't give us that option. Okay, yeah, keep going. Let's see, it might be out of range. You know what? That's right on the border. I'll use that. That's fine. Okay. So let's save that. It's 350 to 750 for a T1. 752. That's fine. I don't need it. Okay. Okay. So now money slices again. So let's find it here. So I think you're gonna have to go back. There's sacrum. There you go. So we're doing our side joint. Okay, so we have our money slice over here too. So I want you to drop your FOV like right here, right within that curvature of the sacrum and coccyx. Perfect. And it's trying to plan an axial oblique again. We don't want that. I want you to unoblique these slices whichever way you want. Okay, go that way. So now we have the FOV in the axial plane, but that means that the slices are angled facing superior and inferior. Superior and inferior. So we want to turn these facing left and right. Over here in the sagittal plane, we have anterior, posterior, superior, and inferior. Over here, we have anterior, posterior, left, and right, but we can't angle the slices here. We'd just be rotating the FOV. So over here, we have superior, inferior, left, and right. So we're going to have to angle the slices vertically in this plane. That way they're facing left and right. A little bit more. Yeah, okay, perfect. You angled it with that already. Okay, so now we have our FOV. It looks centered. You angled over here. I'd go a little bit less.
To the right?
To the left, I would say. Yeah, there you go. Okay. And finally, let's angle down here. Perfect. Okay. Okay, so now everything looks good. We just want to check our coverage, and we can't really do that on a localizer, so we're going to select this plane, and we're going to select series and bring up the new coronal. Let's do the T1. Let's window that down just very slightly down and to the right. Perfect. Okay, so let's scroll through. You can see the sacrum right here. All in here. So SI joints bilaterally. I want you to follow those and make sure that we are covered all the way up and all the way down. Okay, that looks good. Let's go the other way now. Looks good. We might even have too much coverage, but we'll leave it. Okay. Looks good. 2 times 10 is a perfect 20. Looks great. And we could run that, but just to save some time since it's not a real patient, let's drop the next to, yeah, exactly. Perfect. Save that. Great job. Now, what I want you to do is I want you to go to the tests. I want you to go over here. Okay, we're gonna click on, okay, cool, perfect. It's all ours. Just making sure. Yeah, let's go into hours. Perfect. Let's click viewer or double click. Or let's double click on that one. No, that works. It's fine. Okay, so I want you to scroll down and go to the coronal oblique. Let's go to the T1 actually, one below it. View, TV, and view. There you go. Okay, so click here, and we're going to page down. Okay, so keep going. So here you can see the ilium all right there, but it's curved. So if you get a straight slice through it, you're only going to get like bits and pieces of it at a time, and that's what we're seeing here. So keep scrolling. You can see those SI joints right here. Sacrum all right here. Let's go back now. Okay, so sacral foramina, sacral nerves coursing through. This looks like it could be like the sacral canal. Keep going, one more. There you go. So you can see the sacral bodies all throughout here. Obviously, this is the sacral canal right there. You can see the spinal nerves and how they would course through the sacral foramina. So you have all the vertebral bodies, or sacral bodies, I'm sorry. You can't see these two up top, but that's okay. Now, the transverse processes of each one merge or converge laterally, and they form these ala bilaterally. And the ala are what articulate with the ilium and form these sacroiliac joints. Okay, so let's go up one more. Let's see, okay, keep going. That's unfortunate. Okay, so now we're going to come down here to the axial. Let's do the axial T1. So here you can see the coccyx. So let's scroll down. You may have to click on it. Okay, coccyx. Going. Okay, those look like the go back cornua. These attach to, they're basically like these two little things that hang down and they attach to the coccyx and they hold it in place. So keep going. Sacral canal starts at the, or ends basically at the bottom of the sacrum. So keep going. You would have filum terminale in there. Keep going. Okay, SI joint starting to come into visualization. Or you can see the ilium bilaterally. Keep going. Keep going. Sacral foramina. We just, if it's a hole and we got to slice right through it, that's how it's going to appear right there. Keep going. You can still see that that sacral canal. You can spinous process right there. Keep going. Anterior concave, and it looks like we're about to hit the anterior sacral promontory right here. Let's go up one more. Keep going. Maybe not. No, other way. Keep going. Yeah. There you go. Sacral promontory. That prominent ridge anteriorly separates the body abdominal cavity from the pelvic cavity. It also serves as the landmark, forming the promontory angle with L5. Okay, you can clearly see the sacral canal right here, spinous process and whatnot. Still iliac, or sacroiliac joints. Keep going. Keep going. You can see the psoas muscles right here. Now we're in the lumbar spine. You can see that disc and whatnot. Keep going. Keep going. Yeah. See, this is all lumbar spine, psoas muscles still. Okay. Let's check out the sagittal. See if there's anything noteworthy to point out at least. Okay, let's scroll through. You can see the head of the femur right there. Keep going. Keep going. Right there. So this is basically like the sacroiliac joints. Keep going. And now you can see the sacrum right there. Keep going. And now you can see S1, 2, 3, 4. Keep going. One more. So right here would be the sacral promontory. Helps form the promontory angle where you can distinguish S1 from L5. What else? It also separates the abdominal from the pelvic cavities. You can see the fused sacral bodies together. They're 1, 2, 3, 4, 5, and then the coccyx would reside distal to that. One more. You can see the sacral canal, and it ends at the sacrum, but filum terminale continues, and it ends like right over here. Not well pictured, but yeah. You can also see all the pelvic organs like the uterus and the bladder and whatnot. So keep going. I guess that's it for now. All right, great job. What do you need to do before you take your patient off and send them home?
Check your images.
Perfect.